Corinne again at the Divine Pineapple, bringing you another home care video for after your massage. In this video, we're going to address the muscles that elevate your shoulders. So that's going to include your upper trap, your levator scapula, and your rhomboids. This video is for my massage clients who would like to address these tight muscles and flexibility at home in between their massage appointments. If you would like a full routine that includes activation, mobility, on top of the stretching and releasing, or if you'd like to book a massage with me, then please message me on Facebook at the Divine Pineapple Therapeutic and Wellness Center. I also have a website, thedivinepineapple.com, so check me out there if you're interested in any of my services. Let's get into this. You can locate the levator scapula at the top medial corner of your scapula. It originates at the top of your cervical spine. You're going to want to explore this whole area and find your most sensitive spot. Then you're going to lean back against the wall and apply pressure to this spot and not be moving around. You're going to stay in one area. Then you're going to flex your head in the opposite direction and then rotate your head in the opposite direction so you are looking down into your pocket. I'm going to demonstrate this movement again, but when you do this, you're going to want to hold this position for 30 seconds to 2 minutes. Beginners are going to stay around 60 seconds. I'm going to give you another view here of how to do this. Apply pressure against the wall, flex your head in the opposite direction, and rotate your head in the opposite direction, and look down into that pocket. To locate the supraspinatus muscle, you're going to palpate above the spine of the scapula and sink down into that fossa that is there. It's not a very big area, so explore it with your softball, and once you locate the trigger point you want to work with, then you lean back against the wall, relaxing the arm that you're working with and holding the softball with your opposite hand. If you laterally flex your head, then you relax the upper trap muscle that lies over top of the supraspinatus and allows you easier access to this muscle. You're going to hold this position for 30 seconds to 2 minutes. If you're just beginning, I would just stick with 60 seconds. If you find an area that causes any numbness or tingling, then just move a centimeter or two in any direction off of that area until you find an area that does not cause numbness or tingling. For the upper trap, you can use one or both of these balls. I'm going to demonstrate first with the softball. You're going to locate your upper trap, which originates from your occipital area, and it goes down to the lateral third of your acromion and clavicle. Explore this area, find your most tender spot, and then you're going to come at the wall from an angle of about 45 degrees. Then when you get into this position, you're going to flex your head in the opposite direction, and then you're going to rotate your head so that you're looking into the same pocket as the side that you are working on. So it's going to be the opposite rotation from levator scap. You're going to hold this position for 30 seconds to 2 minutes. For beginners, I recommend staying around 60 seconds. Now I'm going to show you with the bigger trigger point ball, because depending on the area that you're working with, the softball may not be big enough to allow you to put pressure on the right area, because some of the trigger points are right at the base of your neck. So that's why you might need to get a bigger tool such as the trigger point ball. I'm going to demonstrate both with the softball and the trigger point ball from the side angle so that you understand the position you need to be in. Again, when you get into this position, you're going to flex your head in the opposite direction, but then rotate so that you're looking into the same side pocket. Once you reach this position, you're going to hold it for 30 seconds to 2 minutes, or 60 seconds for beginners. And then you can locate another trigger point, and if you need to use the bigger ball, you can use the bigger ball. If you experience any numbness, tingling, or burning sensations, just find a different spot. Now you have rhomboid minor and rhomboid major. Minor originates from C7 and T1 to that top corner of the scapula. Major originates from T1 to T5 to the vertebral border of the scapula. Explore this whole area for trigger points. I included the overlay for the most common trigger points. Once you locate where you want to work on, you're going to lean back against the wall and the side that you're working on. You're going to take your arm and you're going to give yourself a big hug. This puts the rhomboid on stretch and allows you to address them more effectively. If you locate an area that causes any kind of numbness or tingling, then just move a centimeter in any direction and find an area that does not cause the numbness or the tingling. For these next two stretches, you're going to want to be seated. You're going to take the arm that you're working on and you're going to reach behind you and anchor it down so your scapula is back and down. And you're going to flex and rotate your head in the opposite direction, looking down into your opposite pocket again. And this is the stretch for levator scapula. You're going to hold this stretch for 30 seconds to 2 minutes. Beginners, I would stick with 60 seconds. You don't want to overstretch your neck. So just go to where the muscle is taut and don't overstretch it. Now here's the stretch for the upper trap. You're going to take your arm and anchor it back into the same way to make sure that scapula is fixed. You're going to flex your head in the opposite direction, but then you're going to rotate the opposite direction that you did for levator scap. And this targets the upper trap. You're going to hold this for 30 seconds to 2 minutes. Beginners, 60 seconds is best. And again, you don't want to overstretch the neck muscles. You want to just hold it taut. And now if you want to do the same thing again, you can anchor that, laterally flex your head, and then you can kind of do that rotation and you can feel the difference in where the tension is. You can feel which muscle pulls taut when you rotate your head back and forth when it's flexed. Now for this stretch for the rhomboids, you're going to want to find something that is well anchored because you are going to be grabbing it and you are going to be leaning back so that it pulls your scapulas forward and that stretches the rhomboids. You want to hold this stretch for 30 seconds to 2 minutes. For beginners, I would recommend to stick around 60 seconds. And that is the stretch for the rhomboids. Another good stretch for rhomboids is child's pose. You're going to want to get into a kneeling position and then put butt to feet and lean forward. You're going to want to posteriorly tilt your pelvis in this position, and that's going to get a good stretch on the low back. And the more you reach forward with your arms, the better stretch you get on your scapular musculature. You're going to want to hold this stretch for 30 seconds to 2 minutes, 60 seconds best for beginners. If you feel like this isn't stretching the muscles the way that you want it to, or if you advance past it, then what you can do is you can get a foam roller. Yep, foam roller right there. And then you're going to assume the same position, but the foam roller elevates your arms off the floor a little bit, and it also allows a greater range of motion. So this should definitely do the trick for you. Another stretch that you can do for your latissimus dorsi is to take your arm and then anchor it over your head and pull your whole scapula and everything up, just like that. You're going to hold this stretch for 30 seconds to 2 minutes, or for beginners, I would recommend staying around 60 seconds. You're going to do both sides, and if it's uncomfortable for you to anchor your arm over your head like that, then you can modify it by just putting your arm straight up and doing the same motion, except for you're not wrapping your arm around the top of your head. And you're going to hold this stretch the same way.